Amelia, my name's Liz. I'm the nurse looking after you today. What's
Hi.
brought you in today?
I've been feeling really unwell lately. I've been throwing up quite a bit and been headachy and just really hungry all the time and thirsty and going to the toilet a lot
How long's this been happening for?
for probably 2 or 3 days now.
2 or 3 days. And have you had any pain?
Had some pain here and in my stomach.
What would you rate your pain out of 10? 10 being the worst pain that you've ever felt.
Probably a 7 out of 10.
Can you describe the pain that you're feeling?
Feels like an acid ball in my stomach.
Okay. Is there anything that makes it worse or better?
Not that I know of.
Okay, Amelia, so what we will do is we'll run some tests. We'll check your blood and your urine, and we'll also check your vital signs. Okay?
Yep. Thanks.
Hi Amelia, how are you?
Still feeling sick.
I am Dr. Coco. I'm sorry to hear you're not well. We'll run some tests to figure out what is happening. How are you feeling at the moment compared to before? Still a bit nausea. We'll give you something for that in a minute. I'll just run this by you. We did your blood test and urine test and came back. You got blood sugar level is high. You got positive ketone in your blood.
What does that mean?
It possibly means you're type 1 diabetic. The main role of insulin in the body is to lower blood glucose levels, which allows glucose to be used for energy or converted into other forms for storage by the body. This occurs in 3 ways. Receptors on the surface of most cells in the body bind to circulating insulin. Insulin thereby acts like a key and lock mechanism by enhancing membrane transport, which enables glucose in the blood to enter the cell. The cell uses this glucose to produce the energy it needs to carry out its functions within the body. Stimulates the liver to store glucose in the form of glycogen and inhibits the breakdown of glycogen to glucose. Inhibits the conversion of amino acids or fats into glucose. This helps counterbalance any metabolic functions that are likely to increase glucose plasma levels. Type 1 diabetes mellitus is the result of hypersecretion and hypoactivity of insulin within the body due to a progressive loss of pancreatic beta cells. Environmental factors, genetic susceptibility and autoimmunity cause this loss of beta cells in the islets of Langerhans of the pancreas. More specifically, the immune system's white blood cells incorrectly identify the pancreatic beta cells as harmful organisms, resulting in an autoimmune response in which the beta cells are destroyed by antibodies secreted by the white blood cells. Due to decreased beta cells, the pancreas produces little to no insulin. Without insulin, cells in the body are unable to use glucose as cellular fuel, causing the body to break down its own stores of fat and results in high levels of fatty acids and their metabolites, known as ketones, in the blood. When ketones accumulate in the blood, their acidity causes the pH level of the blood to drop and become more acidic, a condition known as diabetic ketoacidosis. The response of the body's central nervous system aims to improve the pH of the blood by initiating hyperventilation, shallow rapid breathing, in an attempt to reduce carbon dioxide levels and increase oxygenation and thereby return the blood to a more balanced alkalotic state. Polyuria. Increased levels of glucose in the blood lead to excessive glucose in the glomeruli of the kidney where filtration occurs. The excess glucose then impedes the kidney tubules' ability to reabsorb the water, which means the kidneys produce a large volume of urine. Amelia experienced polyuria before being admitted. Amelia's admission details identified that she was voiding every half an hour. Polyphagia. Glucose in the bloodstream is unable to enter the body's cells due to a lack of insulin, which stops the lock and key mechanism. Due to this, glucose builds up in the bloodstream and the cells become starved of glucose, which is their energy source. Their lack of energy then triggers the hunger response to acquire the glucose needed for normal cell function. The polyphagia will continue until there is sufficient insulin to unlock the cells and provide the cells with energy. Amelia also presented with polyphagia as she reported being frequently hungry and never feeling full or satisfied after eating. Too much blood glucose can cause damage to 4 parts of the eye: the retina, the lens, the vitreous gel, and the optic nerve. Over time, high blood glucose levels cause damage to the small blood vessels attached to the retina. The high levels of blood glucose cause the vessels to swell and over time block, stopping oxygen supply to the retina. The body responds growing new blood vessels on the retina. However, they are weak and break easily, causing blood to leak onto the vitreous gel. This blood blocks the light from reaching the retina. When this occurs, a person will see floating spots or almost total darkness. Sometimes the blood clears out by itself, but other times surgery is needed. According to the World Health Organization, diabetic retinopathy is the leading cause of visual disability and blindness. The kidneys filter approximately 100 to 150 litres of blood to produce about 1 to 2 litres of urine each day. Diabetes mellitus causes microvascular destruction of the kidneys. The high levels of glucose in the blood change the structure of proteins which injure the glomeruli in the nephrons of the kidneys. Damaged nephrons are not able to efficiently filter wastes and extra fluid from the body. As renal function deteriorates, extra fluids and waste build up and cause symptoms to become evident. The first symptoms of kidney disease are often swollen hands, feet, ankles or face. Urine may appear foamy due to small amounts of the protein albumin in the urine. Further symptoms may include headaches, weight loss, anorexia, nausea and vomiting, drowsiness. Other symptoms can include sleep problems and increased or decreased urination. Damaged kidneys can also result in high blood pressure. Keeping blood pressure down will help prevent further damage to the kidneys and also the heart, brain and blood vessels. The most common complication of diabetes is nerve damage. Nerve damage is due to high levels of glucose entering neurons from the blood, causing damage to the neurons. As a result of the damaged neurons, nerve degeneration occurs together with delays in the conduction of messages through the nerves. Decreased blood flow to the nerves can cause sensory loss and limb damage. Symptoms commonly experienced include decreased sensation in the distal aspects of the limbs. Pain, tingling and numbness may also be experienced. Hypoglycemia, which is chronic in nature, may be the cause of cognitive dysfunction. Neuropathy may develop and resolve spontaneously, irrespective of hyper or normal glycemia. High cholesterol develops due to increased blood glucose levels. The buildup of cholesterol causes the blood vessels to narrow, a disease known as atherosclerosis. Heart attack and stroke can result from this narrowing of the arteries due to decreased blood flow through to the heart muscles and the brain. Symptoms may include chest pain, shortness of breath, tachycardia, increased blood pressure, confusion, facial droop, and hemiparesis. Wound healing ability may be decreased due to poor blood flow to the limbs' extremities.
As type 1 diabetes is caused by a partial or total lack of insulin in the body, the main pharmacological intervention used to control blood glucose levels is insulin replacement therapy. Due to oral forms of insulin being poorly absorbed and having poor efficacy, insulin must be injected. Insulin has different length and action profiles based on what type of insulin it is. Each diabetic is different and will require their own insulin and treatment plan to manage their diabetes. Contraindications for using insulin are when the patient is hypoglycemic. The hypoglycemia should be treated first and then insulin adjusted and administered as required. Some patients may be allergic to certain types of insulin such as porcine or beef. If such an event does occur, the patient can be transferred onto a different type of insulin. Side effects of insulin administration are hypoglycemia, edema, visual impairment, insulin resistance, and injection site reactions including erythema, hives, itching, and pain. Blood glucose levels should ideally be checked before each insulin dose is administered to ensure that the levels are in an acceptable range and that the insulin is safe to give. Blood glucose levels may also need to be tested overnight to ensure hypoglycemia is not occurring when the patient is asleep. The patient will be required to see an endocrinologist or pediatrician on a regular basis every 3 to 12 months for insulin dose adjustments. A blood test called the glycosylated hemoglobin test, or HbA1c, is used to monitor the average blood glucose over the past 8 to 12 weeks. The results of this test will show how well the patient's diabetes is controlled and will give an overview as to whether the blood glucose sit above, below, or within the normal range on a regular basis. Test blood glucose levels every 4 hours. Monitoring blood glucose levels before meals, which is roughly every 4 hours in hospital, will allow you to see how effective the last dose of insulin has been. Knowing the blood glucose levels before a meal will allow more accurate insulin dosage and administration and help prevent hypoglycemia or hyperglycemia.
Ensure there is a pen or bottle or toilet easily accessible for the patient to use. Rationale: the patient is likely to have polyuria due to high blood glucose levels and will need to urinate frequently, and often may not be able to hold on for long. Having something available for the patient to use may prevent accidents occurring.
Resolve any fluid and electrolyte imbalances and maintain the balance. High doses of insulin may lower serum potassium levels as the insulin pulls the potassium into the cells. High blood sugar levels and ketones may cause polyuria, which cause the patient to become dehydrated and may cause an electrolyte imbalance. Electrolyte and fluid imbalances may worsen the patient's diabetic ketoacidosis or cause heart arrhythmias.
Manage the patient's nausea and vomiting. The patient may feel nauseous due to the diabetic ketoacidosis, and feeding the patient may cause nausea and vomiting. Nausea and vomiting is uncomfortable and may stop the patient from having good or any intake of nutrition, which may cause hypoglycemia. The patient should be kept near by mouth for the first 24 hours, as this will allow the stomach to settle before the patient eats, otherwise they may vomit.
Maintain patient comfort and a suitable environment. The patient will be unwell and overstimulation of the patient will not allow the patient to rest and recover. An overstimulating environment, either light, noise, movement, and temperature extremes, may cause stress, frustration, or a lack of sleep to the patient, which could lead to difficult and uncooperative behaviours.
Educate the patient and family or carer about how to self-test blood glucose levels. Calculate insulin doses, insulin admission, care for the insulin, diet, and sharps management. Once the patient goes home, the patient will have to be able to monitor their blood glucose levels, calculate and administer their insulin doses, care for their insulin and manage their diet, and dispose of their sharps properly to prevent needle stick injuries.
Make referrals to the required services. Type 1 diabetes is a complex hormonal disorder that requires care of a multidisciplinary team to manage and prevent complications. Patients will require most of the above-mentioned members of the team at least some stage, if not regularly, throughout their life living with diabetes.
Monitor vital signs and observations. Diabetic ketoacidosis may cause abnormalities in the vital signs. Changes in the vital signs can show the effectiveness of the treatment and the progressions of the patient towards a non-diabetic ketoacidosis state.
Provide reassurance to the patient and their family. The patient and their family is likely to be anxious as Amelia is young and some procedures such as blood tests, cannula insertion, fluid therapy and electrolyte therapy are not pleasant experiences. Being hospitalized may also cause anxiety and lower the patient's tolerance threshold, which may slow down recovery time.
Maintain patients' personal hygiene and ensure staff use good hand hygiene. Diabetics, particularly those with high blood glucose levels and/or ketones, are at an increased risk of acquiring infections due to a decreased immune system, so all infection risks should be minimized where possible.
Educate the patient, family, carer about hypoglycemia, hyperglycemia, exercise, sport, physical activity, sick day management, and what to do in an emergency. The patient will have episodes of hypoglycemia or hyperglycemia and will experience sick days and times when they are physically active and will have to manage this once they go home.
Decrease fatigue and maintain patients' energy levels. A symptom of high blood glucose levels and ketones is lethargy, and the patient may not have the energy or motivation to do required or optional tasks, and may need longer rest periods or more sleep.
Monitor bloods and urine to ascertain levels of glucose, ketones, infection, electrolytes, arterial blood gases, etc. in the blood and urine. These tests will give a clearer picture of whether or not the patient is improving or deteriorating. It may also provide information about how the patient's organs are functioning.
Fluid balance and food chart. To ensure dehydration and fluid overloading is not occurring, a patient with high blood sugar levels and ketones may experience polyuria and polydipsia, and the fluid intake and output needs to be monitored. Standard 3. Preventing and controlling healthcare-associated infections. Standard 4. Medication safety. Standard 5. Patient identification and procedure matching. Standard 6. Clinical handover. Standard 8. Preventing and managing pressure injuries. Standard 9. Recognizing and responding to clinical deterioration in acute healthcare. Standard 10. Preventing falls and harm from falls.